In this episode of Breaking News with Bay, I wanted to talk to you about all of the unusual places that you can use Botox and Xeomin. So we all know about Botox and Xeomin in between the eyebrows, or the forehead, around the eyes, the crow's feet. That's pretty typical. But some other places you can use it in the jaw here. You can treat TMJ, so if people are like grinding or having pain here, you can inject these muscles and it'll help relax it. Jan grinds her teeth at night, so what we're going to do is inject Botox or Xeomin into the masseter muscles right here and here. That'll help relax the muscles so she's less likely to grind. But the other benefit of injecting Botox and Xeomin here is it can soften these muscles and give you more of an angled face rather than like a roundish face, more of a heart-shaped face. For whatever reason, a lot of Asians come in and get that area treated to soften the jawline here. The other place you can use Botox or Xeomin is in the lip for a couple reasons. If you have these fine lines like smoker's lines, but you don't necessarily smoke, you can treat it right there, and that'll help soften that area so those lines aren't as obvious. But if a person has a gummy smile, like when they smile, their upper lip goes up really high and also thins out their lip. As you can see in this photo, we can actually do the injections there, and so the upper lip doesn't go up as high, and also because it doesn't go up as high, the lip doesn't thin out as much, so it stays nice and full.
All right, go ahead and smile for us. So, very pretty patient, don't get me wrong, but she's just anxious about how she shows more of her gums than she'd like when she smiles. Go ahead and relax now. And one of the things the patient noticed that when she smiles, this side comes up higher, so we're going to actually distribute a little bit more to that side. We've treated this patient before, so I'm okay with, doing a little bit asymmetrical injections to improve the symmetry. But if it's the first time I'm seeing a patient, then I probably wouldn't do that. I'd want to get an idea of their baseline.
The other place you can do Botox or Xeomin, you can treat the what's called the depressor anguli oris. If the corners of your mouth are coming down, you can inject right here, and the corners of the mouth will come up. Not to give you a Joker look, but just might give you a nice subtle smile. You can also treat the chin. If you have this sort of golf ball appearance, you can treat that area. If you have bands in the neck, you can do Botox and Xeomin there. Another place you can do it is if you have like a lot of excessive sweating in the armpits. Botox or Xeomin, great for that. Same thing with the hands. If you have a lot of sweating, as you can see in this video, a lot of sweating in the hands, you can do Botox and Xeomin there to help with that sweating.
Patient that not everybody always sees that has a issue called hyperhidrosis of the palms, which is just very sweaty palms. We're cleaning off the palms with an alcohol pad, but that shiny appearance that you see to the palm, that's actually her sweating already. That's not from the alcohol pad. So this is kind of the issue we're treating. So now we're just going to mark the areas that we're going to be injecting, and we'll be injecting Botox. That's the treatment for this. And you might be wondering, if we do Botox for the face to relax muscles so that patients don't have wrinkles, then why doesn't Botox to the palms affect the muscles of the hands? The answer is that it actually can affect the muscles of the hand, but the point is we're only going very superficially right under the skin. If we went deeper where the muscles were, it could, but we're not going that deep. We'll go ahead and get started. Just push the needle just barely under the skin, not too deep, and inject just a little bit of the Botox or Xeomin, whatever you're using. So the way this works is that Botox affects the acetylcholine receptors on the muscles or on the sweat glands. So when you use Botox, So other treatments that patients can have who have hyperhidrosis or excess sweating of the palms is they can get something called a sympathectomy, where you actually put a scope in the person's chest, believe it or not, and you clip some nerves that are in the chest. And by clipping those nerves, it reduces the innervation or the stimulation to the sweat glands in the palms, and the sweat glands stop sweating. As you can imagine, not everybody's willing to have a scope put into their chest to have those nerves clipped, so that's why a lot of patients get the Botox or Xeomin into the palms for a more temporary. So if you want to look it up, it's called a video-assisted thoracoscopic sympathectomy. In addition to the palms, you also do the fingers. We just go to each joint of each digit.
There's another place you can do Botox or Xeomin, I'll just refer to the name that you'll see on the internet, called Scrotox. I'm not going to get into what that is because I don't want Instagram to mark this as obscene, as an obscene video, and I also don't want to get in trouble with Megan, who's filming this, for sexual harassment by talking about Scrotox, so I'll just let you read about that on your own. And we've never really done it, so I can't really speak from personal experience as the doctor treating somebody with Scrotox. So, but anyway, hope this is useful, and now you know some other unusual, unique ways to use Botox or Xeomin other than those typical ones. Thanks for listening.